Okay, so here we are at the end of, or toward the end of the chapter here. This is our last of the videos, and I'm just going to see what we can do to finish this up. So we're going to look today, or in this video, we're going to look at fractures and healing of bone, and then look a little bit at skeletal organization, just try to make some sense out of the skeletal the terms for different parts of the skeleton, and then we'll be done. So here we go. All right, so fractures. A fracture is a damage to the bone that occurs when it is subjected to more physical force than it can withstand. And this might be because of extreme loads that are placed on the bone, or sudden impact to the bone, or getting a stress from an unusual direction. So I think we've already kind of put out there that idea of, if this is the, here's the femur, and it comes down, and here's the joint of the knee. So we got the proximal epiphysis with the ball, and here's the greater trochanter. Here's the the diaphysis, and then down here at the bottom would be the distal epiphysis. So it is used to getting loads that come in this direction, where, you know, as if you were jumping up and down on the femur. But if somebody were to come and apply a good karate kick to the femur from this direction, then that would be a stress coming from an unusual direction. And of course, in old age, osteoblast and osteocyte activity decreases, and the bone becomes thinner and weaker because the osteoclasts still continue on at fairly good pace, breaking down bone material. And so the bones can become more susceptible to fracture as well. A very common injury for older folks, especially women, older women, are includes when the ball here of the femur, when there's a crack that occurs right through here. We talk about that as breaking the hip. Well, it's not really the hip bone that breaks, it's generally the femur, the head of the femur breaks there. And so that's a common one that gets grandma regularly. Okay, so if we were to talk about different kinds of fractures, we could talk about them by a lot of different characteristics. And so let's take a look at this. So if a fracture is non-displaced, that means that the bone ends remain in their normal position. So if this was the bone here, and here's the break, but the bone ends are in pretty normal location, then that is a non-displaced fracture. If, on the other hand, that bone were to be found to be jutting over like this, then we would talk about that as a displaced fracture, where the bones are out of their normal alignment following the fracture. If the fracture goes partway through the bone but doesn't completely break the bone, so if it's a fracture that's like this, then that will be an incomplete fracture. A complete fracture would be one in which the bone is completely broken into two or more parts. So complete versus incomplete fractures. We can talk about the way that the fracture orients to the long axis of the bone. If that fracture is, so here's the bone again, and if the fracture is running down the length of the bone, then that would be a linear fracture, whereas a fracture that comes across the bone would be a transverse fracture. If the bone ends pierce, where the bone was broken, pierces through the skin, then we talk about that as an open fracture, also known back in the good old days as a compound fracture, while those where the bone ends remain inside the skin, so they don't project from the skin, then that will be a closed fracture, also known as a simple fracture. But open and closed are more common terms nowadays. Which of those would you imagine would be the most dangerous? probably this open fracture because of the risk of infection that would come with it. A closed fracture is unlikely to get infected. Now, it could be dangerous because it's bleeding or whatever, but a closed fracture is at least has less risk of infection. And then we can classify fractures based on the nature of the fracture itself. A comminuted fracture is this example here. That's comminuted fracture, and so it's when the bone breaks and it breaks into multiple fragments. And this is common among elderly folks. So, a fall where a person tries to brace themselves with their arms, say, as they go down, but because of the force of the impact, the bones in the forearm may break into many little small pieces. A spiral fracture is one in which there's a twisting action, and so that's what this picture here is showing. So if you can imagine, if this end were held still, and this, by the way, is the fibula that they're showing there. If it's held still, but the other end of the bone is turns in a twisting way, then that can cause this kind of spiral fracture. A depressed fracture is one in which the bone is broken and is pressed inward. So, if we think about, say, a skull fracture, here are the eyes, here's the upper jaw, and here's the lower. Oh gosh, terrible lower jaw. But you kind of hopefully get the idea. Here's the lower jaw. A depressed fracture might be one, say, where somebody takes a hammer to this person's head, and the bone is dented inward in that location. So you have breaks along the way, but it's depressed into the skull. And then finally, a compression fracture is one in which a bone is crushed. And compression fractures are frequent in vertebra. So as people age, especially, and bones become more brittle, then the vertebra can be crushed, or again, in a fall, a compression fracture may be a piece of what happens there. So again, lots of small pieces in a compression fracture. All right, so we've got some more pictures to look at, looking at the classification by the nature of the fracture. An epiphyseal fracture is where the epiphysis is separated from the diaphysis, and that's what I'm showing here with this X-ray view. So we're looking, again, here's the distal end of the tibia, here's the fibula coming down. Now you can see there is some damage here, but also notice how the end of the tibia appears displaced, and we have a break right here. So the epiphysis has been completely separate, or is separated from the diaphysis. Here's the diaphysis. So that would be an epiphyseal break. And it usually happens there at the zone of cartilage death, before as the cartilage is weakening, but it hasn't become ossified yet by the bone, by those bone processes where the epiphysis is, or that epiphyseal, that growth plate is growing. So there, in the zone of cartilage death, and the growth plate is usually where these epiphyseal fractures occur. A green stick fracture is what we're seeing here. Trying to draw an arrow. That's a green stick fracture, so it breaks partially through the bone, but the bone is still flexible enough that it bends on this side. So we get an incomplete break, and this is more common in children than it is among adults, as the bone is ossifying, but it isn't fully ossified, then green stick fractures can occur. An impacted fracture occurs when the bone breaks and the ends of the bone are driven into each other. So again, I give you the example of falling on an outstretched hand. So here's maybe the radius. Sorry about that. Go away. So here's the radius, and there's a break that happens, But then, to make matters worse, these bone ends are driven into each other, causing a lot of crushing and other damages to the bone itself. A fissured fracture is like that linear fracture, so it's another term for a linear fracture. An oblique fracture is one that occurs at any other angle than the right angle. So here's an oblique fracture, an oblique angle. So the transverse fracture would have come right across the bone, but because it's at a very steep angle with the long axis, we talk about it as an oblique fracture. So what do we do then to repair, or to help the body to repair a fracture? They're treated in two ways. First, by reduction, which is the process of getting the bone ends back into normal alignment if they are not aligned properly. And it can be a closed reduction. That's when the doctor uses his or her hands to coax the bones back into alignment, maybe uses a little stretching, putting under traction. But that work is done without any kind of surgery. With open reduction, that's when a surgical procedure is performed, and then the bones are realigned during that surgery. So once the bones are aligned, then it's time for fixation. And so they are fixed, or that is immobilized, in the correct position so that they can heal properly. External fixation, probably the most common external fixation method, is the use of a cast. But braces or splints, other kinds of external tools, can be used to help hold the bone ends in their proper location. Internal fixation relies on the use of metal wires or plates, rods, pins, screws, nails, any of these metal materials that are used to hold the bones into proper alignment. That would be internal fixation. So open reduction with internal fixation means that surgery was done, the patient was cut into, and then hardware was installed inside, at the bone in order to hold the bone ends in the proper place for repair. So when we think about healing, if you had to choose, do younger or older people heal more quickly? Well, you probably would suggest that younger folks are going to heal more quickly. Children, young folks, even young adults have better circulation generally than older folks might have. And there's a lot more hormonal stimulation in younger people as well. Upper limbs tend to heal more quickly than lower limbs, which is an interesting little fun fact. And then finally, spongy bone repairs more quickly than compact bone does. But of course, compact bone, when it is repaired, will be the stronger of the two of those bone types. Okay, so what are the processes, the stages of fracture healing? Well, the first thing that happens in a fracture, and here we got the picture, this is the same picture as in the book. You can see a complete fracture here across a bone, somewhere between transverse and oblique fracture that's happened to this particular bone. And because there is so much blood supply to bones, anytime there is any kind of break like this, there generally is a lot of bleeding. And so a blood clot forms internally as the vessel hemorrhages, as the blood vessels that are broken hemorrhage. And that forms what is called a hematoma. That's that soft mass of blood clot. Now, a blood clot is not going to hold bone ends in place, but it will have a function that we'll see about in just a minute. So the cells, any of the bone cells that are in this area, are not likely to do well. They're probably going to die fairly quickly from nutrient deprivation. And the injured tissue becomes swollen and red, hot, painful. It becomes inflamed. And we've talked a little bit about inflammation already. So I'm expecting you to be put on board with that. So the first thing that happens then is this blood clot forms, and that seals up the break. So it stops the bleeding and keeps foreign materials from entering into the break site. Second is the formation of what's called a fibrocartilage callus. So the next thing that happens then is that blood vessels start to grow into that hematoma, and they bring with them phagocytes and osteoclasts that will do the work of cleaning up all the debris. So the osteoclasts will secrete their enzymes and their acids that will break down the bony material. Phagocytes will come sweeping through and clean up. They'll swallow or engulf and destroy any of the material that is found there in the bone break. So then fibroblasts and osteoblasts invade from both the periosteum and the endosteum. So that inner layer of the bone will grow out and begin to cover over the trabeculae that begin to form. And up here at the surface, a periosteum will form around the hematoma. Fibroblasts in there will produce collagen fibers, and those fibers will be used to help span the bone ends. And some fibroblasts will go ahead and differentiate into chondroblasts and start producing a cartilage matrix. So that so cartilage gets woven in with all of the collagen fibers, and that makes the fibrocartilage callus. And then osteoblasts move into that area and start producing spongy bone matrix. And this resulting mass of tissue that is developing is referred to as the fibrocartilage callus, and it splints the break back together again. Helps to hold the bones into a locked, rigid position. Now, it's not particularly strong yet, but it will get there. Third step that happens is that a bony callus begins to form. So as new trabeculae form within the fibrocartilage callus, then gradually that callus is converted from fibrocartilage into bony callus, this big mass of spongy bone that serves as a stiff, hard callus material. And this process will continue until a firm union between the two bones has been, or the two pieces of the bone has been formed, and usually that takes around 2 months or so. So after an injury to the bone, then you'll see first the hematoma forms, then a fibrocartilage begins to form, and almost immediately within that fibrocartilage, then spongy bone will begin to develop as well. And so that's the conversion then of the fibrocartilage into this bony callus. And then finally, remodeling steps in. So we have spongy bone, but it's in an area where perhaps compact bone is needed. Maybe it's the diaphysis of the femur that got karate kicked and got broken that way. So the spongy bone of the bony callus is remodeled when the osteoclasts move in and start to remove that, remove the bony trabeculae, and the osteoblasts then reform compact bone around themselves as appropriate to whatever the site is. And so this remodeling, it begins as soon as the bony callus is starting to form, but it may take quite a while, several months, for it to complete the remodeling process. And at the end of this, then the spongy bone is being remodeled into compact bone, and here would be all of the osteons that have been rebuilt in the area. And note that there's a little thickness here. The bone is going to be even stronger at the break site, although with time, even that lump of tissue will be remodeled away, and at some point you can look at the bone and not even know that it's been broken. So all of this may take several months to complete, and this is all work that is going on. It begins as soon as the spongy bone gets laid down, but it can be a much longer process, they say, than the length of time that a person has the injured part fixed in an external fixation device like a cast or whatever. So it's a fairly long process to get there get to the other side of a break like this. Okay, now it's time to talk a little bit of skeletal organization, and then we'll be done. So the skeleton, it's about 20% of the total mass of the body. Within the skeleton, there's about 206 bones. I usually say about there because the wormian bones and any additional sesamoid bones that develop are not included in this 206. It also includes cartilage, which is found in joints, at the tip of the nose. The ribs also have cartilage in them, so cartilage is found throughout the skeleton. The joints, the articulations, the places where bones move past one another, and then finally the ligaments are included in the skeletal system, and their job is to either connect bones or to really reinforce a particular joint. So when we look at the portion of the skeleton that's called the axial skeleton, so that's everything that runs down the central axis of the body, we see 126 of those 206 bones, and it is the portion of the skeleton that supports and protects the organs of the head, neck, and trunk. So the skull, it's composed of all the cranial bones, the facial bones, and then 3 middle ear bones that are found in each ear, so a total of 6 middle ear bones. So 3 times 2 ears equals 6 total. The hyoid bone, the bone that's right here underneath the mandible, serves as a point of attachment for the tongue. The vertebral column that starts right up here. Oops, sorry about that. Go away a little. We are a vertebral column that starts just up here and then goes all the way down through the sacrum. And the thoracic cage, which is built of the sternum here and all the ribs. All right, so that is the axial skeleton. And here's the appendicular skeleton. Again, the same picture. This time I want you to look at the yellow stuff. So it's all the appendages and the body of the body and the bones that are used to hang them from the body. So it involves both the pectoral and the pelvic girdle. So here's the pelvic girdle, the 3 bones on each side, so a total of 6 bones in the pelvic girdle. The upper limbs, and then the pectoral girdle includes the, if you can see them back there, the scapulae, and then all the bones of the limbs as well. So the shoulders, the hips, and that's it. Let's see, the hip is divided into 3 bones. The larger ilium, so here's the ilium, and it owns a little piece of the socket here. And then here in the front is the pubis, and here at the back, the bones that you sit down on, some people call them the sits bones, are the ischium. And that's how you pronounce this word. I-S-C-H-I-U-M is ischium. I'm going to put that in quotes because that's not really how it's spelled, of course. And then all the bones of the lower limb as well. So approximately 80 bones in